I'm Jeremy Barnett and I live in Fort Myers, Florida. Been here just over 40 years. For over the last 30 years, I was a fitness trainer. I owned my own gym. I also did post-injury fitness rehabilitation. And about 4 years ago, I retired, sold the gym, and during that time took on video production and editing. I think that's where my back issues began, was just constantly sitting in front of a computer for so many hours, and my core got weaker, my hips and back got weaker.
We sat down with Jeremy at his home to learn more about his pain and what brought him to the Bonati Spine Institute.
Almost a year ago, when I was doing a motorcycle ride, it was about 200 miles. When I got back, I tried to take off my boots, put them down on the ground. When I tried to get back up, my whole back locked up. From that point on till my surgery, it just progressively got worse and worse and worse. After the motorcycle, it hurt for probably about 2 or 3 weeks, and I knew something was wrong. And then it started to get a little better over time. I'd have aches and pains, every few days or so, but it wasn't, debilitating. I think it was probably about 2 months prior to seeing Bonati. I was on the stairs and my cat was down there. I was trying to pick up the cat, and that's when my whole back just let out. So I'm not sure what happened, but it literally dropped me to my knees. I couldn't get up, I couldn't stand, couldn't walk, and basically crawled up the stairs, crawled to my room, just kind of laid in the bed, and that was it. It was pretty painful after that, and for 2 months straight, basically couldn't bend down to pick things up. Just doing basic household activities was nearly impossible.
Like countless others with lumbar spine issues, his discomfort radiated into the lower body, affecting his personal life as well as his career.
It went from my right hip down the back of my leg through my hamstrings down to my feet, and occasionally I'd feel it at my toes, like numbness and tingling in my toes. As a video editor and then also doing video production, I have a lot of gear that I have to carry with me. Some of it's anywhere from like 20 pounds to 50 plus pounds, so that was nearly impossible. So I had a walker that had wheels, so what I would try to do is load my gear on top of that and just kind of push it along, get it to the car, kind of try to get it in the car as best I could. And I mean, it was pretty painful and excruciating through the days just trying to get through them. And there were a few jobs that I had to decline and turn down just because I couldn't physically do them.
Jeremy tried a number of conservative treatments prior to surgery, but was ultimately met with the realization something more had to be done.
Literally anything, I could get my hands on just to try to numb the pain and, just make it through a day. Ibuprofen, Tylenol. So I was doing that. Ice packs I would use a lot, taking a lot of showers, just trying to get my body to relax. I would do some light stretching. I was really limited on what I could do, especially trying to get down to the floor to lay down and then trying to get back up was nearly impossible. I actually had a chiropractor friend that I worked for years ago. I did post-injury fitness rehabilitation for him, so I really trusted him and his judgment, and I had him try to do some chiropractic therapy. We did massage therapy, we did E-stem, so we tried a few different things, but it just wasn't working. It wasn't getting any better. So he was nice enough to at least be honest with me. He told me, he said, there's not much else we can do at this point. Go get an MRI. Let's see what's going on. So I had the MRI, came back. He looked over it and definitely saw that there was a herniation. So he said, you need to, find a professional that can, maybe do some surgery and take care of it.
Finally, he took to the internet to do some research.
I was looking online through Google, doing searches for doctors in the area, and couldn't really find anybody local here in Fort Myers that I really felt comfortable with. And just happened to be on Facebook looking through, and I saw an ad, and I saw a guy probably close to my age and pretty in shape. And he was lifting weights and doing pretty much all the stuff that I did when I was in the gym, and saw that he actually went through it, made it through the other side, and was back in the gym doing exactly what he loved to do. So that kind of got me hooked on talking to the Bonati Spine Institute, called them up, and kind of took it from there. I actually spoke to a surgeon, and they talked to me, asked me about my MRIs and kind of what treatments I had tried prior to thinking about surgery. And then they said, definitely come in and see us.
In March 2020, Jeremy traveled to the Bonati Spine Institute for consultation and surgery. First, a walk across the parking lot to the on-site imaging center, then a meeting with the clinic staff and surgeon.
I do remember going in, they did the consultation with me, they did blood work with me. They actually did new MRIs just to see where I was at currently, because the other ones I think were about 6 months old, so they want to see if anything had changed. So the diagnosis they told me was two herniated discs, my L3 and L4. So those were the ones they would have to do surgery on.
During the consultation process, the Bonati Spine Institute will explain the use of conscious IV sedation, and Jeremy explains his experience with this technique during surgery.
He brought the MRI and we went over the MRI, showed me where the herniation was, discussed the surgery, what was going to happen. So that was really nice that he kind of took it step by step, explaining exactly what was going to go on, especially with the anesthesia. Previously, when I was 20, I had the same surgery on my L4, L5 discs. This time it was on L3, L4. But at that time, I was completely knocked out. So I had no idea what was going on until after it was finished. Whereas this one, I was partially awake and kind of almost like in a dream state, back and forth. And occasionally they would ask me questions, see how I was doing. So he kind of explained that that's how it was going to be, just to make me aware and kind of comfort me a little bit and let me know that, you know, they would keep the pain down as much as they possibly could, which they did. I mean, I don't ever remember being in pain.
In the recovery area, patients begin walking immediately after surgery.
Within a few minutes, nurse, whoever was there with me, had me sit up just to make sure I could get up, let me kind of get oriented for a few minutes, help me stand up, try to get my balance, and then from there they had me walking up and down the room probably for like 5 minutes, just back and forth, doing laps back and forth. Haven't had any issues since then.
Jeremy describes more about the traditional surgery in his 20s, including the hospital stay and the excruciating recovery.
My first one in my 20s, I was knocked out the whole time, so I didn't have a clue what was going on. Woke up, they actually kept me in the hospital overnight, so I had to actually stay there in a bed. It was several hours after the recovery when I woke up. They had me to try to walk around just my room, just, you know, around the bed and back. Had me lay back down. I was there for the rest of the night. After that, I had probably a good 3 months of rehabilitation therapy, which was pretty excruciating just going through that. That was pretty brutal. And after that, it was probably almost a full year before I was kind of like back to normal, feeling, you know, like I could get back to the gym and do the things that I normally did.
But because of the targeted and patented techniques of the Bonati Spine procedures, those issues are no longer a concern.
With this one, literally had me up a few minutes after the surgery, kind of walking around the room. I was feeling good. I didn't have any pain. And I believe it was only like 5 weeks after the surgery, I was off my medications and pretty much back to feeling normal. I mean, I was using a rowing machine that I have here at the house. I was back in my gym working out and, you know, walking around the neighborhood, doing anywhere from 1 mile to 3 mile walks. So literally I could do everything I wanted to do almost immediately afterwards. It was pretty amazing. I was back on my job doing my work that I needed to do, and, you know, I didn't have to miss any jobs or, you know, postpone them, so that was pretty nice. I was most shocked and surprised about how fast the recovery was, and I guess being out of pain so quickly after surgery. I didn't expect that at all. So to go through Bonati and literally, you know, right after surgery, not have pain, be able to get up and walk and move, and, you know, within a few weeks being almost back to normal, doing all my daily activities was pretty exciting and amazing. Go in, get an assessment, get MRIs, and see what they can do to help, because they definitely helped me. I mean, I feel 100% better now.